My name is Allison McLellan. I'm a medical student at the University of Central Florida College of Medicine. I've gotten to meet a lot of great physicians, and the interactions that I've had with these people have got me thinking, what is their life like? How did they choose their specialty? What kind of training did they have to have in order to get where they are today? What does their day-to-day life look like as an attending physician? What lessons do they have to share with me and with other medical students? So today I'm going to introduce you to one of these doctors. That way you can hear their answers to some of these questions and hear what they have to say.
I'm Shilpa Gurnurkar. I'm a pediatric endocrinologist at Nemours Children's Hospital. I actually was born and raised in India, and that's where most of my family still is. I actually went to med school in India, and I did my residency in New York, and I did my fellowship following that in Miami. And now I'm here in Orlando. So as you can see, I love the tropics. The common diagnoses that a pediatric endocrinologist and also our group takes care of is type 1 diabetes, which is juvenile diabetes, type 2 diabetes as well in children, short stature, growth problems, puberty problems, whether early or late, thyroid problems, underworking, overactive thyroid. We also take care of adrenal problems, blood sugar problems, hypoglycemia. Certain other rare conditions would be disorders of sexual differentiation and so forth.
How did you end up in endocrinology?
Well, first of all, I'm going to start with how I ended up in medical school. It's going to start off very cliche and then end differently, but I actually come from a family of doctors. My grandfather was a doctor, my uncles, my dad, and wonderful doctors in a way that very complete, I think, not just in terms of they're doing well, but I think they truly care about their patients, and that's what inspired me from the time I was little. And actually, when I was thinking about going to medical school, my father said to me, it's going to be a very long journey. Are you sure you want to do this because you want to do it right? And I said, yes, I do. And then that's how I got into medical school. Pediatrics, I love children. I have a big family, extended family, and so a lot of children at home I've seen from the time I was little, cousins to nieces, nephews. So I've always been very fond of children. That's one side of why I chose pediatrics. The other side to it is I think it's very challenging because you take care of little babies to almost adults. And so you see that whole evolution, and I think it's also very exciting as well as challenging. Endocrinology, as unbelievable as it may sound, it is actually really one case of DKA. So DKA is diabetic ketoacidosis. It's a complication of diabetes. Well, I was a medical student then, but during my rotation in the ICU, I met this 7-year-old boy with type 1 diabetes who had very little access to healthcare, who was brought in DKA. He was very, very sick. He was intubated. And I worked with him all night and all day till he was conscious again. And I was very surprised how something that could be so easily taken care of with insulin and should not have reached this point. And so I said, I'm going to help children prevent complications like this.
What drew you to kids?
I think everything together. It is very challenging to work with them. I will not deny that. And, you may see 6 patients one morning, right from newborn to 18 years old, and the approach to every child is very different. But that's what I find very challenging and very fascinating. And I think they just keep you active all the time. They keep you young at heart, and that's what I love about it.
Medicine is one of those things that it comes with its own language. It comes with its own set of terminology and things that when you're first coming into it, and especially as a patient or a parent, it can be kind of confusing and scary. So how do you go about bridging that gap between, what you know and what you're an expert in, and then making it so your patients kind of understand what you're doing?
I think that's a wonderful question, and I think that's what I work on every day to improve myself and keep getting better to the point that, I get perfect at that. But for a parent or a grandparent or any caregiver for a child, I think the anxiety is much more when your child has a problem than when you yourself have a problem. And we see that every day. It does make it even more difficult when you don't understand what actually is happening to your child. So I avoid using medical jargons with parents. I try to explain everything in the words that they understand. And I think the Nemours, family approach really helps me with that, where I'm able to spend time with the family and explain to them what exactly is happening, so they feel more comfortable. It certainly may not take the condition away, but I think if it helps the parents understand what exactly is happening with their child, it also helps with management of the condition better.
Someone actually mentioned to me that how they deal with patients was actually influenced by things they saw in their training and then people that they dealt with during their training. What was your training like for you?
So I did my pediatric training in Brooklyn, New York, in a very, very busy hospital. And so, in different scenarios, for example, the emergency room, there's not much time and there is a lot of anxiety. In a way, I think those situations also help me because then you try to learn how you can actually help the family in a short period of time, how you can relieve their anxiety in a short period of time. And now it's different because now, I'm only mostly outpatient medicine, but that really helps with that, with that skill. I think my mentors have played a great role. I've been very fortunate to have wonderful mentors. They still are my mentors, they will be. I have several mentors and I try to take different qualities of theirs that I really am fond of and put them together so I can use, those qualities in my life as well. My mentor from fellowship, he has been a great influence in my career. I talk to him almost, every month. We talk about patients, how to deal with certain situations, not just medical, but several other challenges.
My kind of definition of what I thought was a good doctor has changed the more I've been in the medical field, the more I've experienced things. I used to think it was just someone who knew everything and everyone just respected them and thought they were awesome and got the job done. And so while I still agree with some of that, it's changing and I see things that I think are important are like teamwork and, your ability to work under pressure and things like that. What kind of qualities do you see that make a good physician?
I think a little bit of all of that is true. One might think great training is what is more important. Another one might say great training is one thing, but keeping up to date with research is important. A third person might say all that is fine, but in the real world, when you actually start seeing patients, your compassion towards patients is more important. Well, I think it's a combination of everything together. One may have certain qualities, some of these, and they may still be a great doctor. And I think it's several things that make somebody a good doctor. And I think a little bit of everything is important to differentiate between just a good doctor and a top doctor.
What do you do when you have parents that come in that are really scared about having their kids be here? Is there anything special that you do for them, or is it more, like this is how I see my patients and it kind of works for everybody, or do you have to tailor it for different situations?
No, I don't think it works for everybody. Absolutely not, especially not in pediatrics. Parents have different levels of anxiety, and I think what I try to do is to tailor that to every patient. I listen to the parents first and try to assess what is going on in their minds and then see what is the best approach for them. Some parents just need more counseling. They just need more time to be spent and everything explained to them, and that just calms them down. Others may need a little extra help, or they just need to see their child get better, and that makes them feel better. So I think with time you start understanding that a little sooner, but I think the most important thing is spending time with the family, letting them speak, and then understanding what exactly their anxiety, so that can be helped.
Having a family, that's really in medicine, did that kind of change how you looked at things? Or, you mentioned your father said, hey, this is pretty hard. Are you sure you want to do this? And you still wanted to do it anyways. What was that like, kind of growing up with a history of family in medicine?
Even to date, and everybody's still practicing, so even to date, they still inspire me every day. I think they are a big reason why, I kept going, and it was good that I was prepared that it's going to be hard, that, I wasn't surprised halfway through thinking, what is all this going on? But I don't know what it is like to be any other way, because that is my family, and I have many physicians in the family, and so growing up, I've seen every side of it. I have seen how much they have worked hard and how sometimes they had very little time to spend with their families. And then on the other hand, I've also seen how that work was also appreciated, and how they are also involved in a lot of service work. And that has always been my goal, is to be like like the doctors in my family.
Is there something that you wish that your patients or your family members knew about you that would put them at ease, or is there something that you wish that they knew about you before they came to visit you that you think would help them?
I think the information that families get, and this is even me thinking of it as a patient myself, when I'm trying to find a doctor for myself, I just go by what is available there. Google the doctor, go to the website of the hospital and see where they trained, and maybe how many papers they have written and things like that. All that is important. I do agree it's very important. But what I think families don't know, that they do not find information, is what I feel is important in my practice, is time that is to be given to families, is to actually put yourself on the other side and think of it from a mother's point of view, and not just say, oh, this mother's just very anxious, but try to understand why she's anxious. Like they say, treat every child as if they were your own, and I truly believe in that.